most common one that you're going to hear is that you're over 35. Okay. So in the medical model, that's a risk factor. And when you have a risk factor, that makes you high risk in their mind. And part of it is because that's the way they're trained. And part of it is because it actually generates more revenue when you have to do more things to somebody because you label them as high risk. But a risk factor should not be equated to high risk. All right. Because what is the risk is what you really need to know.
Yeah.
Not that it's a risk factor. Is the risk 1 in a million? Is it 1 in 2?
Yeah.
Right. Yeah. If it's 1 in 2, that's a little risky, I'd say. Okay. It's a cup half full, cup half empty argument. But if it's 1 in 100 or 1 in 1,000, you take 10 different people and you tell them that the risk is 1 in 500. And some of those people are going to think that's a high risk. And some of the people think that's a 99.8% chance of it not happening. Okay. So it's really how you present things to them. And the medical model is just on the hamster wheel of everything's a problem.
Yeah.
So so the first thing they come in and they tell you that you're over 35. So when I do virtual consults with people, one of the first things they'll tell me is, yeah, I'm over 35, so I know I'm high risk. And I smack that one down right away. that it's not a risk factor. Yeah, there's a slightly increased risk of genetic issues. And so those things get ruled out now. We have great tests that do that, which are non-invasive. That set of tests has its own problems because there are false positives with that lead to more worrying and stuff like that. So every time you do a test or every time you order something, there are benefits to it and then there are downsides to it. The medical model does not usually emphasize much of the downside of anything that they order.
Right.
The medical model doesn't like chaos. They like to control everything. But actually they cause chaos, but they're comfortable with the chaos that they cause. They're not comfortable with the chaos that maybe nature might do, or that you have a risk factor. That's not comfortable for them. But if their intervention causes more problems, they're okay with that.